From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Vincent Figueredo, Chief of Clinical Cardiology and Associate Chair of Medicine at Einstein Healthcare Network, and this is The Heart Show. Our topic, heart disease risk. So let's get right to the questions that stem from our viewers. Who is at the greatest risk for heart disease?
Well, the fact is, heart disease is the number one killer of both men and women in this country. So in a sense, we're all at risk. And it really has to do, genetics play an important role, but it's the risk factors for heart disease that lead to all the disease that we suffer in this country. High blood pressure, high cholesterol, diabetes, cigarette smoking, physical inactivity.
What are some ways that patients can prevent heart disease?
The major one is lead a healthy life. Don't smoke, period, end of story. Physical inactivity is horrible. Leads to obesity, diabetes, high blood pressure, poor cholesterol counts. So get out every day if you can. The guidelines say at least 5 days a week. For 30 minutes, go for a walk. I don't care if you dance. I don't care if you swim. Do something aerobic as many days a week as you can. And then finally, eat healthy. I mean, portion control. We eat too much food in this country. So if you really moderate what you're eating and you eat a healthy diet, fruits, vegetables, avoid fatty foods, fried foods, your heart will love you.
Is there a test that doctors can give for people and their risk for heart disease?
Well, in general, what we do is when we meet with people, if they're not having symptoms suggesting heart disease, we talk about preventive cardiology, preventive medicine. So we are looking at their blood pressure, their cholesterol, their risk for diabetes. We talk to them about smoking and physical exercise. Once people start to have symptoms, then we have multiple ways of assessing whether they really are at risk for significant heart disease and whether we have to do something beyond risk factor modification. Medications, additional tests, do we have to actually go in and fix an artery in the cath lab or in the operating room?
Thank you so much for sharing this great information. Be sure to watch more episodes on this topic and other issues of interest to all patients here on The Heart Show. We will see you next time.
From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.